Hi, folks. Thanks for being with us. We're going to talk about a few things that, we talked about how to sell a big case or how to gain acceptance of a big case. I hate the word selling, don't you? But that's what we do. As a matter of fact, I'm the salesman in chief in this office. That's right. All I do. Yes. So let's talk about why we're getting together today. We're periodontists. Some of you are prosthodontists. We might have an oral surgeon or two in the group. And sometimes we just tend to, we have these fetters, we have these barriers. We can't go beyond this. And whatever it is, we just can't talk about it. And we're going to talk about how we talk about it today. And now we see, we just had acceptance of what? An $87,000 case, something like that.
Oh, yes.
Yeah. So, yes, I know. For those of you who say, yeah, but you have restorative dentistry in your office, let me tell you, we did this before we had restorative dentistry in our office. Right. It started when we were a referral practice and gradually got patients coming into us. But even when we were a referral practice, we were gaining the treatment acceptance, both for restorative dentistry, for the referring dentist, as well as for us. So I want you to kind of loosen those ideas. Get rid of those ideas, those things that are limiting you, because they don't, and they don't have to. I know of a limit that we all place on our staffs. They didn't go to dental school, so how can they treatment plan? You know what? I've got 3 staff members who can treatment plan pretty darn good, and I want them to do that. So let's get rid of all the barriers, all the things that people say you can't do, because if you go from can't to can, all of a sudden, the treatment plans are going to be there. The patient's going to say, this is the right place for me to get it done. And there are plenty of people who want to get those big cases done. How do we know? Look at that organization that has clear and choice in their title. And clear choice is expanding. Some of you say, well, clear choice, they only do one thing. And I understand they only do one thing. But clear choice has also permitted everybody to spend $50,000 on dental care. Isn't that nice? They can do that with them. They can do that with us. And many choose to do it with us. And many can choose to do it with you. So I want to loosen the barriers a little bit. Just think of what can do. Take some notes. Make sure you have, whether you're taking notes electronically or whether you do it the old way with a pen and paper, take some notes, because these are the things that Danielle and I are going to talk about that you can bring back to your practice tomorrow or Monday that will be very helpful to you, and things that you can start to experiment with and work with to get your practice rolling, maybe in different and hopefully a better direction. Okay.
Dr. Sheldon's very passionate about sharing that with other periodontists around the country, because if it can work for us, it can work for you. And it all started with thinking outside that box, because if we kept doing the same thing that was comfortable over and over, we never would have made these changes and we never would be where we are today. So please keep in mind that we are a working periodontal office, and that's what we do all day long. And so we're just sharing these successes with you.
So why do people come into your office? Those of you who are experienced know what I'm about to say. Okay, there are 4 reasons why people come into the dental office. And let me do a share screen, which is always a challenge for me. Let's do that. Okay, so they want to do this. They want to smile. They want to chew. They want to be free of pain. And they don't want their mouths to stink. That's the reason people come to see you. Mm-hmm. Oh, I know we'll talk about periosystemic and all of these other things related to heart disease, and everything. What do I have to tell you? No, people don't see a dentist for that. We may mention it. We may gain some referrals from it. Hopefully a cardiologist or 2 are referring to you. But this is the main reason. So we're going to cover the following areas. Those of you, you all signed up for the webinar. So you saw these were the points that we are going to go to: getting the price barrier into the opening and out of the way, And by the way, that's first for us. It isn't we lead you up to the sale. It's, get the price barrier out of the way. Find out what the patient wants and let the patient understand what the costs are. For the different types of dentistry, it makes a big difference. Because you know what the patient's thinking? Patient's thinking, how much it's going to cost? How much it's going to cost?
The whole time.
Yep. How to interview the patient, get to the root cause of what the patient is really seeking. And that takes a little bit of skill, but those skills are pretty easily learned. You'll learn those tonight. Co-creating the treatment plan with the patient, getting the spouse on the patient's side, assisting the patient on the mechanics of financing, which is a big deal. And strategies for follow-up when the patient does not accept right away. And that's even a bigger deal because on the larger cases, almost nobody accepts right away. And unless they have a follow-up strategy,
correct,
it's not going to go anywhere. Okay. So let's get the price barrier into the open and out of the way.
Right.
So let's talk about that a little bit, Danielle. Let's get back on camera. Okay. So that's you. Right. You're getting the price barrier out of the way, not me.
And the case acceptance does start from that first phone call they make to your office. So from the very first phone call they make, we do talk to them about what it is that they're looking for. I mean, our number one transition question is, what do you have going on? Because we do want to know what's going on. We do want to know what it is they're looking for. So we need that story. And that starts the close of the sale right there. We find out what it is that's going on. We find out what it is that they're looking for. We find out what it is that they want. We're typing all this into the computer and we're doing that so we can know where our start point is. And we're also talking about different options. And we'll talk to them and say, that's horrible, or we hear this all the time. And we have solutions here. We can help you with that here. That's what we do here. We can do anything from extraction, dentures, all the way to extraction implants and a fixed in prosthetic. There's a lot of things we can do. And there's also, because we are the number one periodontal office that you can find, we have ways that we can possibly save those teeth too. So why don't you come on in and let's find out everything that there is. And when we're on the phone, we even talk about some prices, some estimates. Why do we do that? Because there are some people that only make $500 a month. And there are people out there that have the money, but they need to see value in what you're going to give them for that money. So as we're spending time with them on the phone and we're talking about all this stuff and we're putting these prices, they're getting an idea of what they're coming in for. And we do have a really good stat on how many of those new patients show up. They show up. Now, when they come in, they're already excited. They already know. So again, with price barriers, when I take the patient back and we have the assistants, that the one that takes them back and takes the Xrays and does the exam is the same person that's going to be sitting down with them doing the treatment presentation. So they know, and we go over, what is it that you're looking for? What is it you want? We let them hold these beautiful models in their hand, the fixed and prosthetic. We let them see all these beautiful befores and afters. So we do all that so we can say that something like this will cost you somewhere around, anywhere between $2,000, $5,000. Something like this will cost you between $10,000 and $15,000. And something like this will cost you anywhere between $20,000 and $30,000. They're holding it, they're looking at it, they're seeing all that. And when they're able to be in the middle of it, somehow the price doesn't sound that bad.
Doesn't.
Nope.
And I've met many who say, patients, because we do marketing, and patients who show up for marketing, first of all, they never show up or they don't spend any money. Our show up rate in our office has to be well over 95%. So again, we're here to be able to show you how to do this. We know all the barriers you've encountered. When I advertise, nobody shows up. Or these patients are just kicking tires and they they just want to compare prices and all that. No, they're not. They want dental work. Yeah. They may say that. And if you're buying into that, my goodness, you have some skills to learn, because if you're buying into that, then you don't understand what the patient wants and why the patient has called you to begin with. And you've got one shot. You've got one shot when that patient calls. And unless you have a phone scheduler who knows how to interview the patient, and that phone scheduler is the most impressive person that person has ever met in a dental office, and says, I'm not going to go to a new website, I'm going to go here. Right. You're not going to get to this sequence. So really, really important. But we get the price barrier out of the way, and let's go to the next one. Okay. We take X-rays. They're so important, right? You know what's most important? It's not the X-ray. A person wants to look at himself.
Right.
Or very often, they don't look at themselves. They're going like this. Or they're not looking at themselves in the mirror at all. You want to find a reason for a person to make a decision. It's to let people see that person the way others see that person.
The patients we see, they've learned how to talk without showing their teeth. They learned how to smile without showing their teeth.
You've seen that.
So we got to see their teeth and show them their teeth.
So there's her teeth. Okay. And we want her staring. We want her looking at that. And the way it's going to happen is the big screen in front of the patient, big screen, 40-inch screen, 50-inch screen, whatever you can have room for, just use it. Monitors are cheap. Just go ahead and do that. The next part of this really is the tone level, and the tone level of the people that are working with the patient. There's a certain amount of acting that goes on.
Oh, yeah.
There's certain times that I may not feel the best. You ever experienced that with me?
Maybe a few times.
Yeah, okay. And you got to fake it. Okay, so you that person is there to be assured that this is the right place to be. And one way that it can be a good place to be is to have the friendliest office. And the tone level is important. I give a lecture on tone level to our staff last week. Why? Because it was time to revisit what's going on. We have 23 people in 2,000 square feet.
It's tight.
We bang into each other a lot.
It's tight. Yeah.
Yeah. And so, and as soon as we recognize tone level goes up, and we had a very good week this week.
We've had a pretty good.
We had a pretty good year this year.
Yeah.
And a lot of that has to do with tone levels. Matter of
Yes.
fact, Danielle and I meet every once in a while, and that's essentially what she tells me to do. And the staff says that when my tone level is up, that we get a lot more treatment acceptance.
It's contagious.
It is.
It's very contagious.
Yeah.
So my biggest job is just making sure everybody's tone is up and tone is in check. Because when our tone is high and our tone is of help and guiding these patients to accept treatment because they're being positive, and it's contagious to other staff and contagious to the patient to feel good, because patients are going to buy when they feel good. They're not going to buy when they don't feel good. They're not going to buy when they're frustrated and irritated and angry, and no, they're not going to. And especially not going to buy if your staff is not being happy and making them feel good. I mean, the same thing when people go buy things in a store, they buy the most at these stores that feel good, smell good, bright. People are smiling, music is playing. It's all about that. And so I do spend a lot of time with our clients and with our staff to make sure that is in place. And again, when you go in,
I have 1/2 hour with a patient.
yes,
Patient has a 2-hour experience in the office. A half hour is mine. During that half-hour period, what's the first thing I do? I will ask questions about the patient. I want to know who he or she is.
Right.
Hi, how you doing? I'm Sheldon. Welcome. I know you're here. Tell me a little bit about yourself. I want to find out who that patient is. And you know what? The patient loses his overcoat because he comes in with an overcoat. She comes with an overcoat. Loses and say, well, I like to do this. I like to do that. My hobby is playing golf. I like to draw. I like to paint. I've just established a new company, whatever it is. And they'll talk about themselves, which is important to me. I really want to know who that person is. Sometimes I get some good information from those people, but more importantly, I want the patient to understand that I'm interested in that patient, not in the teeth. We're going to get to the teeth. And I've got a half an hour to get through this, but the first 10 or 15 minutes is talking with the patient. And I want to know what that patient likes. I want to know, and the person who's asking the questions is the person who's controlling the conversation. So you see, if I ask questions and the person answers, and then I acknowledge that answer and then encourage with a new question, And I know, yeah, people can talk on and on. I understand. And sometimes they have to acknowledge it and say, well, thanks for telling me. Let's go to the next subject. I've got that. But at the beginning, it's engagement and engaging that patient. So we finally get to the question of what is the problem you are trying to solve? And the problem that you're trying to solve is not that I'm missing some gum tissue on the facial aspect of tooth 29. I'm sorry, that's not the problem they're trying to solve. Oh, if they had irritation on number 29, they might say that. You know, this area hurts. But more often the problem they're trying to solve is I'm a salesman. I want to be able to smile because they want their tone levels to be up. And how's the tone level up? You smile. You know, why did I get my veneers? Because I wanted to be able to smile, particularly on camera, because I'm on camera, or at least I was on camera quite a bit. There are reasons why people get dentistry done. And it has to do with, well, I can't chew anything anymore. Well, that's simple. I can't smile anymore. That's simple. Remember, smile, chew. Be free of pain, which we always do, and don't want your mouth to stink. Well, that's periodontal disease. So understand those are the four reasons, and we want to find out which one of the four that patient is concentrating on, because the patient is concentrating on that. That's how I know how to communicate with the patient.
Yes.
So let's talk about co-creating the treatment plan with the patient. Let's go back to the screen a little bit. You know, part of the co-creation has to do with providing materials that the person has never seen before. So if I'm examining a patient for periodontal disease and I find a number of pockets, and then I take a plaque sample and put it under a phase contrast microscope, which may have cost me $3,000 or something like that, and the patient sees bugs swimming around, don't you think that's a little bit different from what that patient has seen anyplace else? Mm-hmm. If I say, I really don't know what these bugs are, we see they're swimming and we see all that, I think I'd like you to spit in a cup and let's send that saliva sample out to the laboratory. So the laboratory can identify how aggressive these bacteria are, and we have a better handle on what we need to do in order to be able to get this under control. Maybe you'll need antibiotics, but I've got to know what antibiotic is the correct one. Have I now differentiated myself from any other dentist or most periodontists that patients see? All of this is done in 30 minutes of my time. That doesn't mean I get the oral DNA test in 30 minutes. That takes about 7 days to come back from the laboratory. But I've introduced all of these new ideas to the patient, and the investment is not that great in order to be able to provide that. So there's some other things. Okay, so we use the Anatomage software. We've used the Anatomage software for 10, 12, 15 years, maybe. People are still fascinated with the idea that I'm putting implants into the bone, and they can see what the implants and what the teeth are going to look like. Simple, $5,000 piece of software where I can feed the DICOM files directly into that software from my CT scan and be able to show the patient and do the surgery in advance. Anatomage isn't the only software that does this, but Anatomage does have a graphics program that's pretty darn good, pretty darn slick. And it's a lot different from just scrolling through the CT scan, a black and white CT scan, and hoping the patient understands what thickness of bone is all about. Here, the patient gets to see an implant in teeth. Okay. Another way is doing cosmetic imaging. Well, I'm just a periodontist. Why do I have to do cosmetic? Prosthodontists know that's important. You know that. I'm just a periodontist. What do I need to know? The reason is that you're bringing the patient forward to what? Smiling or chewing. Well, if it's smiling, and just take a look at all of the smile, all of the dental offices that have smile in their title in some way, you know that most of them are looking to be able to smile. And so this company envisioned a smile, essentially, is you send the photograph out, you send it out to Envision a Smile, they give you a new smile. which you can show to the patient.
The outcome is what patients are looking for anyways. A lot of times for periodontists, you guys have to create that healthy foundation in order for them to get delivered that beautiful cosmetic dentistry. And so you are essentially selling for you. And if you're a referral practice and you want to be a referral practice, your guys are going to love you even more when you can sell plans for them as well. And we did that for years. We could sell their restorative plans better than they can. So they really loved referring to us because we did all the legwork for them. All they did was collect the payment.
That's right. That's all I did, collect the payment. So let's talk about getting the spouse on the patient's side. Mm-hmm. A lot of people come in because their spouses have said something to them. Sometimes the patient may come in and the spouse has no idea. And right. All the spouse would say is, how much does it cost? So imagine, you've seen it. Patient comes to the office, you say, all right, I got a great treatment plan. Patient is very excited, goes back, and you never see the patient again. Why? Because all the spouse heard was
$25,000.
That's right. We want spouses to come in. Oh, I know. I've heard the COVID excuse and all that. We want the spouse to come in. Yep. Okay. And we want the spouse to come in every single time. As a matter of fact, in our welcome to the practice letter, which I'm sure you're all sending out, in that letter, we encourage the spouse to come in.
Yep.
The patient is mentioned to me because I'll call all of our patients before the patient comes in. The patient says, I need some work. And I encourage the patient to bring the spouse in. We want the spouse to come in. Yep. So that's part and parcel of a major treatment plan. And patients, we do the same examination on everyone. Don't forget, I'm in the operatory for 30 minutes. We do a 27-point examination. I'm only in the operatory 30 minutes. I've said that how many times now? 3 times? 4 times? And the patient routinely leaves and says that's the best dental examination I've ever had.
They always say that, yes.
Now, I used to spend an hour with a patient. 50 minutes. We tried 15 minutes, tried 40 minutes.
And we were trying to find a way to fit more new patients into our schedule because we were at a point where we couldn't fit anymore. So we reduced it down to 30 minutes. And look, we're doing better than we were doing with an hour.
That's right. That has everything to do with the person who's spending the additional hour and a half because it's a 2-hour experience. Right. So your treatment coordinator, and that's the person who's meeting the patient at the beginning, carrying the patient through the examination, and carrying the patient right through to treatment acceptance. Same person. We don't have a closer over here. It's the same person all the way through.
Right.
That person develops a relationship with the patient and allows me to be able to leave after half an hour.
And I also will tell you that when the spouses do come, and we even encourage it on the new patient phone call, it's on the check sheet for my girls to say, is there somebody in your family that helps you with these decisions? And whether it's a daughter, son, or whomever, we encourage them to bring that. And I'll tell you that what we usually find is at the end, when it comes to the financial, the person they're with is encouraging them to do it. The patient's going, I don't know if I want to spend this much money. And the spouse or the child is saying, Mom, do this for yourself, or honey, do this for yourself. You deserve this. And so a lot of times we see that if they would have taken that information home blindly and the husband or daughter wasn't there, like you said, all they see is the number and they're going, $25,000 for what? For what? Yeah. No, because they weren't there to feel all the diagnostics of the pictures and the Xrays and the software and the prosthetic in their hand and the before and after. And it becomes real to both of them at that point.
Not everybody can even afford $25,000.
Sure.
We understand that. There are many who can, many who can't. We have just, we get Google reviews, things like that. One of the finest Google reviews we ever got said they don't provide any pressure at all. There's no pressure. I will give them the partial denture plan.
Sure.
And tell them what that is. I'll give them the dental implant plan and tell them what it is. They'll see both variables, understand that we're going all the way through, and I will give my treatment coordinators different treatment alternatives, obviously at different costs. So the patient knows that he or she has gotten a complete treatment plan, a complete diagnosis and treatment choices, leading them in whatever direction they feel they need to go. And of course, I'll say, listen, you're doing a whole lot better with dental implants or crown and bridge work, or whatever it is we're going to do. If we can go in that direction, you'll feel more comfortable. If this is all you can do, And this is all you can do, and your restorative dentist can do that for you. Okay, so as long as I'm explaining the differences, it's up to the patient as to what the patient wants to choose. So, Daniel, let's talk about assisting the patient with mechanics of financing.
Right.
Because this is a big deal. Nobody comes in saying, "Here's a $50,000 check. Go, just do it."
Right.
So, how do you get them? How do you get them through this?
Well, I mean, really, the secret to it is everything we've talked up to at this point. So the goal is when you're getting to the room where you're going to be showing the number, they're already sold. The last thing you want to do is get them on the schedule, have them arrive and come in, do a quick examination, and then get them in a room and then say it's this much, because you're not putting any value. So from the time they get off the phone call, doctor phone call, coming into our office, having everything that we've done thus far, we put such a big emphasis on the value of this treatment that this is actually the easy part, is when we get into this room, because they're ready to go. We've already talked about numbers and estimates, and they already have all the idea. So all they're doing when we get into the room is, yes, we've given them all options. We take pride in giving our patients every option that's known to them, as well as giving them an idea of what each option is going to give them. So that's where it's key. And yes, you can get a partial, however. Yes, you can get a bridge. However, yes, you can get an implant. And so we give them all these options while they're in there. When we do get to the room of financing and giving the price, it's really, which one did you want to do? Great. When do you want to do this? Great. Okay, now we have different options. And we do give options and payments as well. You can either pay in full today. We can give you a discount on that for going ahead and paying for it in advance and getting it done. Great. My favorite, because it's done. I don't have to put money anymore. We can pay 10% down today. We can pay the other remaining 2 weeks before the date of the surgery. And that's the other option. Or they can do financing. So if you want to do some payments, we can do financing with interest, without interest, 12 months interest free, or interest out because it's smaller payments. So we keep that high tone because we're offering them options, and options feel good to patients because they don't feel like this is it. It's 6,000. You pay today, it's 6,000, you pay day of surgery, whatever it is. We give them those options to make it where, because one of those fit everybody. Some people have the money, they don't want to let go of it. Some people, want to give a little bit now because they're not fully committed. And some people, most of our patients love the discounts. Save 5%, pay today. So you're going to lose out on $500, but you're going to get all your money up front. You don't have to worry about payments and chasing people and collecting day of, and it's much easier. So we give those options, we write it down, and then we're good to go. So it's all just giving them those options. But as we said from the beginning, we're filling out the patient. We're finding out what they want. We're finding out what they can do. I know exactly what they're going to do when I get to this point. It's just telling them what it is.
And by the way, that doesn't change what I'm doing. If I feel the patient can have a staged treatment plan, or if the patient's periodontal disease is so out of control that I have to know that phase 1 is going to be done, and before we go to phase 2, we're not rushing into phase 2. We're not getting treatment for phase 2 done if I'm not sure that we don't have the basics under control. The infections have to be gone first before we go anywhere. And even if that's all we do, we go phase 1 treatment, the infections are under control, we're going to keep your teeth, and now we may need to delay the next phase of treatment. That's fine. People are not coming in here. Everybody doesn't walk in here spending $50,000 or $25,000. They don't. Okay. It's being realistic with the patient, applying the skills you have in order to be able to give needful patients the results that they need. And maybe I ought to concentrate on this a little bit more. Those who've seen me write, and I'm writing another article about this right now. Ethics is really, really important. More important than ever, within the dental field and outside the dental field. Let's talk about within the dental field for a second. When we have the opportunity of providing the patient with a periodontally healthy mouth, where there are others who say they're providing periodontally healthy mouths that aren't necessarily seeing a periodontist, I got to tell you, it's a big deal. It's a bigger deal than we've ever thought, because There's so much else out there that isn't being done exactly the way it should be. So understand that the patient has an opportunity. You're creating an opportunity. Your schooling and your dedication to providing a disease-free mouth, frankly, is something that the patient isn't going to find very, very often. So don't undersell yourself. It is a big deal. And as you're seeing more and more patients that are being treated less than ethically, you know how big a deal that is.
And we don't close every case that we present.
We don't.
And our goal is not to close every case we present. Our goal is to help the patient. And we all know that. Dr. Sheldon makes that known. Our goal is to help this patient. So if a patient expresses us throughout this process that all they get is $500 a month for Social Security or whatever it is, of course they're not going to accept the $25,000 case that they need, but they're not going to accept it. They can't afford it. So we do still an examination with the patient. We still find out what it is that they need, but there is a low cost dental clinic that we send a lot of patients to that can't afford it. There is a denture clinic down the street that will do upper and lower denture extractions for like $800. We have to use that sometimes. It's not the best option out there, but it is the only option for these patients. But we will provide them with that information, and they always say thank you for helping us. We're not going to tell them nothing because we can't make money off of them. We are trying to help them. Listen, we would love to help you here, but I don't think this is the office for you. Let me give you this number. These people are willing to help you out. And they call us back and thank us. They send other people to us. A friend of mine said that she came to you, she couldn't afford your work, but she said, you know what, if you can, you need to go there. And these are big plans that come to us from these people. They are really thankful for that. So it's not that we're catering to these people that have money. No, sometimes we're just helping them out.
No, we are not a high money.
Right.
I wouldn't think. I mean, we know the rich neighborhoods.
Yes.
We don't concentrate in it.
No, we don't.
At all. So no, I mean, people have a desire and they find a way.
Sure.
Of paying for it if they want it.
Yeah.
They can't.
There's a running joke in the office. If they pull up on a Mercedes, you're not accepting. If they pull up on a clunker, they're going to be accepting. They got money hidden under their mattress. So we learned a long time ago not to judge a book by its cover. A long time ago.
I drive a 2013 Toyota, so for God's sake. All right, now not everybody's going to accept right away. Understand that group isn't going to accept right away. So what are the strategies that we use for follow-up for those patients to say, well, I got to move money around, or I'm not sure, I've got to talk to so-and-so, or whatever it is? What do you do?
We spend a lot of time on follow-ups because he's right. It's the bigger plans, they don't always accept right away. And sometimes they'll say, let me give you a call back. Let me go talk to my family. Let me go talk to my bank. Let me find out about my 401k withdrawal. Sometimes there's things we have to do. Sometimes they're just trying to get out the door. I get it. Most of the time they're not. And even if they are just trying to get out the door, maybe they just need some time. So follow-ups are very important. The number one thing is we follow up by the end of the week because we still want to contact them while it's fresh. If you wait a standard 2 weeks end of the month, odds are you're not going to get them back. So we will do an end of the week, just calling to see how you're doing. It's not, are you ready? It's, I'm just giving you a call. I know we threw a lot of stuff at you to see what your thoughts are. See if I can help you with anything. See if you need anything. See how they're doing. We do a letter the day that they leave. It was nice meeting you. We know what we gave you was a lot, but we always, the phone call, the email, the letter that we send, we know that when you came, your goal was to go to a restaurant and order anything that you want because you haven't done that in many years. We want to help you reach that goal. So another reason why we talk and we get all this is because we want to know what the pain point is. And sometimes you think the pain point is money and it's not. Maybe it's pain and maybe it's something else. You want to be sure that you know how to talk to this patient, their language that they understand. So we do send a letter the day of. We do call them at the end of that week. We do at the end of the week, when we are talking to them, when can I call you to check up on you again? You're going to go to the bank next week. All right. But how about if I call you Friday after you've talked to the bank on Thursday, just to see if there's anything else I can do? Or we just try to get them to come back. Once you come back the day after that bank appointment or the day after you're going to see your family, let's just sit down, just you and I again. We'll sit down, we'll talk about this and see what else we can do. So you do want to follow up until the point where you feel like you've exhausted it. And it might be after the first call or the third call. It depends on the person, but you have the person follow up that was working with that patient because they know that patient like their neighbor. There's still patients that call me to this day that I had a few years ago just to talk to me because we're friends now. We create those kinds of relationships. And it feels good to do that because you feel like you've really made a difference with them. So when they are accepting, they're accepting going, okay, Danielle, I think I really got, I got that money from the bank and I'm ready to go. And, you want to be able to do those touches and not just you're done because they couldn't accept the day that they came in.
It's true. I work Monday, Tuesday, and Wednesday, and I'm doing most of the exams for the office.
Yes.
I do 19 exams a week. Yes. 19 exams a week. That's all I
Yes.
do. I don't do surgery. I don't do anything else anymore. Although I did do a flap a couple of weeks ago.
Yes.
I'm so proud of myself. Anyway, it was so 19 exams a week, and probably for most weeks, our biggest collection day is Thursday.
It's Thursday.
It's the day I'm not here.
It's the day his assistants that see him for these 3 days, Monday, Tuesday, Wednesday of new patients and reevaluations, their busiest day, not his, because he's not here. Their busiest day is Thursday. They still come in at 7:00 in the morning. They still work till 5:00 at night, and they are seeing these follow-ups that they have agreed to come back on Thursday to sit down and talk to them again, or on the phone, or doing a Zoom. They're working, and they collect more money on Thursday than they have Monday, Tuesday, and Wednesday.
We hope you have a happy Thanksgiving. Thanks for joining us.
Thank you.
Bye-bye.